Hello, everyone. Nice to see you guys. I think we have just a few people who are, trickling in. We'll give folks a little bit of time to join. All right, welcome back from your break. I hope you guys had a wonderful 15 minutes. We are almost at the end of this wonderful day, and I am happy to present here at Nashwa's annual Unity Conference. Definitely happy to be here. We have about an hour or so, a little over an hour to get through this presentation. So I'm just going to go ahead and get started if you guys don't mind. This afternoon session is going to be all about uplifting CHWs as executive mentors because we understand that CHW voices matter, and we know that there are huge ways and opportunities that CHWs can shift dynamics in healthcare and advance health equity. So I'm going to go ahead and go on to my next slide. One of the most important thing for me to do today is to really get to know who's in the room. So while I'm going through today's learning objectives, if you guys could go ahead and just throw in the chat, like what state you're in, how long you've been a community health worker. I would love to get a feel for who's in the room. Today, I am going to walk through Impact Equity Program, where we like to lift CHWs up as executive leaders, and they are mentors in this space. So what I'm going to do today is talk through how we at Impact have really developed this program. I want to make sure you guys know who Impact is and what we do. I want you to understand the role of community health workers in our operations and our goal to really transfer power. Everything I'm going to talk about today relates to transferring power to communities and to community health workers. The next thing that I'm going to do is I'm going to demonstrate a unique way that CHWs can be elevated, lifting up that voice and respecting them, while other stakeholders can learn from CHWs, and maybe we can help provide better care and service to community members while we're building empathy and cultural humility and all of that good stuff, and helping folks inform future decision making. The last goal that I have today is just to demonstrate ways that we can foster authentic dialogue using that CHW voice and creating awareness among executive leaders about how privilege really does shape health overall. Thank you guys for throwing it in the chat. It looks like we've got folks from Virginia and Wisconsin and Rhode Island and Minnesota. Wow, all over the place. Even Nevada and Texas. Experience from 3 to 7 or more years. Lovely to see it. So excited to see such wonderful people in the room. For today's session, I just want to kind of level set and let you know where I'm going. So we're going to start with a couple icebreakers. I love to get folks engaged in the chat. Wish I could see your faces, but I'm going to just encourage you to use this chat and I will reference it. And I'm going to go ahead and go over an impact overview. Just want to make sure you know who we are and what we do. Then I'm going to set the stage for the conversation by level setting about the healthcare landscape, just so you know where I'm coming from and the why we think of when we think about our impact equity. And then I'm also going to think about and share the nuts and bolts of our CHW mentorship program. I'll go into some successes and challenges, and then hopefully you guys have some questions out there. And I believe you can even ask questions in the chat or using the Q&A function in Zoom. So here's what I'm looking forward to do with you. So first, let's break the ice. Let's continue to get to know kind of who's in the room. Oh my gosh, someone's been a CHW for 32 years. That's simply amazing. I myself probably have been one all of my life. So I guess I hit that bucket too. All right, so let me see. We've already done this one. You've already shared how long you've been a CHW and in what state you reside in. So thank you for answering that question. The next thing I want to ask you guys is on a scale from 1 to 10, Can you just tell me how important it is that organizations that you work for provide a space to listen to CHWs directly? One means, that's not important to me and where I work. And then 10 is like, oh, that is super important to me and where I work. Oh my gosh, yes, I'm seeing the 10s. Oh, and 100% yes. This is a really big deal. CHWs love to be heard. And I think more organizations need to create that space where we can have some authentic dialogues and conversations and really listen to that community health worker workforce. Now I'm going to ask you another question. On a scale from 1 to 10, please share how important it is for you to see systems change at the place that you work. Systems change is like, you know what? They don't operate by after just listening to CHWs the same. Like they take your feedback, they pivot and they change and they do better for you and the communities that you serve. Oh my gosh, it looks like everybody's a 10. This might be a first where most questions that I'm asking, people are right up there with me in recognizing how important this is. Wonderful. Thank you guys for sharing. I think I maybe have one more question. I'll just click my slide. Now tell me, how important is it for you to develop critical skills like organizing and leading small groups as a CHW? And think about this in, the vein of mentoring, executive leaders or others. How important is it for you to be a leader in that space? One, not necessarily critical for you at all. 10 meaning absolutely. All right, wonderful. 10, I love to teach others and support them. You know what? I think that that should be added to the definition of community health workers. Like we love to teach, we love to share that knowledge and support each other. Thank you for that. And I wonder how many of you have thought about the fact that you can do this if you are even in healthcare systems where there's executive leadership. And you guys have been using these emote icons, I think, all day. So feel free to share, heart, celebrate, clap, whatever you feel like doing, so I can make sure you guys are tracking with me in this conversation today. All right, so before I get started, I want to make sure you know a little bit about Impact Care, and I'm happy to share that we are a sponsor for this year's conference. So it's really awesome for me to be here on behalf of these wonderful people. I'm pretty sure, I think I'm sure, there is no other organization in the world full of such big CHW fans. I'd like to just share that we are really focused on making sure and enabling community health workers to have exactly what they need to be magical and do that at scale, which means across the nation, across the world, and more. We love supporting community health workers. I am Janée Tyus. I am the head of community mobilization, and I am that in title and in background. I've spent my entire career focusing on ways to improve the community from a grassroots level all the way up to policy in the state of Michigan. I've spent my life really leveraging my brain and thoughts and opportunities about advancing the community health worker workforce and have been a CHW in a couple different places and spaces, primarily and most comfortably at home with my family. I know you guys know if you're a CHW in the world, you're probably doing the same thing at home, and that's exactly what I've been doing. So Impact Care is a public benefit corporation, and we're dedicated to enabling the CHW workforce. So we provide sort of infrastructure support and technology to make sure CHWs have what they need to do greatness time and time again. So we at Impact have spent about the last 16 years building the tools that we think is necessary for CHWs to do great work. And we help organizations hire and train authentic CHWs like yourselves. And we make sure they have the training and tools and everything they need that has actually been designed by community health workers here at Impact as well. So we've tested this model, and we are very proud to say that it's proven to have, huge outcomes and return investment on the healthcare. So we like to make sure you guys know we are all in for CHWs, making sure we're partnering with policymakers and other states and other organizations, really advocating for everything that this workforce needs, including sustainable financing and ways to share your voices. So big CHW fans here at Impact Care, and I'm happy to be here on behalf of the organization. I wanted to share here that, listen, CHWs make the difference. When I think of the healthcare workforce and the next generation, I'm thinking CHWs. We know that it is, I say, prime time CHW time, where there's an opportunity for us to leverage and lift up this workforce, make sure we're improving the value of the healthcare sector, and most importantly, providing equity to communities, to patients, to people, and to CHWs. So what we try to do here at Impact is keep some important principles right in the front of our minds that guide our work. First things first, we want to transfer power to you. We want to transfer power directly to our community health workers. And we're doing that in a bunch of different ways, one of which I'm happy to share and go through here in a little bit. We always are uplifting the CHW voice. We hear time and time again, nothing for CHWs without CHWs. So we respect that voice, and we make sure that folks are in the room and able to share their voice and their perspective. And we go where our CHWs want us to. We also provide that end-to-end infrastructure, and we're empowering CHWs with technology. Not like you need technology to be great and do what you do, but I think it might help you a little bit to have some tools that work for you. All right, so one of the things that I just really want to tackle and just dig into is some of the things that we run into that I'm sure you guys already know as it relates to this, landscape of healthcare, where everybody is trying to integrate community health workers into the healthcare system, and we love that, but that also comes with its own sets of challenges, and I think of them as also opportunities. Medicine involves lots of decisions for healthcare teams and their patients. Like, everybody's always making decisions about like how much medication one should take, or if they're able to see a specialty provider, and X, Y, and Z. So there's lots of decisions to be made in medicine, and that happens for patients and also for their healthcare teams. And so we also think of that as not only do patients have to rely on decisions, but those that work in healthcare also have to rely on decision makers. Those leaders in healthcare are often doctors or nurses or other professionals. Tell me, at the organization in which you work as a CHW, who's making the decisions? Is it a doctor? Is it a nurse? Is it someone else? Is it a CHW? I hope, but primarily not in healthcare. We often have to rely on decisions being made by providers that could be doctors, nurses, or something like that. There are lots of articles out there as well. You can look up the, New England Journal of Medicine or National Institute of Health. Like, they're all out there. They're sharing that, the landscape of healthcare really is a little disparate. You see a bunch of people. Those doctors and nurses are probably members of the majority population. They're likely white or male, right? There are a bunch of like gender and ethnic disparities that we see in representation among healthcare. And that can lead to a couple different things. And you can even see in medical schools, they're reporting that there are gender and demographic disparities, even those in school to become doctors and nurses. So in my head, I'm like, man, I guess we're never going to get away from this. So what we have to do is figure out a way to inform and educate those folks about the real. And we know the CHWs have it. this disparities that we see when people are doctors or nurses and they are majority members, they often don't even understand the struggles of the patients that are coming in. And so what you'll see in these decisions are power dynamics that are just potentially harmful. And there are some misunderstandings that we can see in healthcare. So here at Impact, we like to think of this model. I'm going to go to the next slide. And thank you, Estella, for engaging with me. She shared the doctors and nurses lead her organization as well. Nonprofit resource families in Nevada. Okay, they give up a leg up in all settings. Awesome. Now, this is where, this is something tricky. One of the things that I shared earlier is that impact seeks to shift the power dynamic. So what we're trying to do with impact is acknowledge all of the ways that power can influence health, right? So if you look at this slide, there are 6 different images, and there are likely 6 different opportunities where we can sort of leverage our understanding of power and promote policy that will often lead to sort of a change in behavior for communities and customer organizations. So we're thinking at Impact, like, how do we measure power and how do we transfer power? First, you got to know where it is to figure out how you're going to change it. And so one of the things that we like to think through is this visual right here, where you can sort of attack the mind, where people are thinking and formulating their thoughts and the reasons that they make their own decisions. So we're thinking about the psychology of the privilege. How do those decision makers even think, right? And we're thinking through ways that we can help them think new things by leveraging that CHW voice and making sure they hear and understand them. We can also shift power through policy. Like, we can advocate for systems change all day long, and often that we do. And I know you guys probably have experience with that as well. We can also tackle the distribution of wealth, hire and empower people that are affected by disadvantage. That's what CHWs are here to do. We want to make sure we give people a leg up and an opportunity to influence and change the landscape of healthcare. And then you can influence living conditions. There's unmet social needs that we can address for those communities that we serve. Then we can hopefully influence behavior change and encourage power and agency in that way. And the other thing we can do is try and bridge the gaps within healthcare teams. So there's lots of opportunity here. And Tobin McKee said, you can also shift power by creating CHW-owned cooperatives. Ooh, I love that. Love it. I agree, Tobin. So what we're trying to do at Impact, I think my slide should be moving. There we go. I want you guys to understand that we respect the voice of CHWs all day and every day. And I think the way to tackle the left side of that equation to inform the psychology of the privilege is to use the voice of CHWs in ways that we haven't in a very long time. What's important to understand here is that we recognize that CHWs are leaders in every way, shape, form, and fashion. Impact has been working, like I said, to integrate community health workers for about the past 16 years. So we've got some experience in recognizing that that lived experience of CHW is like gold. And not everybody can understand or operate like you because they've never been there. They haven't done that. They haven't experienced and they haven't grown through things like you have. And so we need to sort of recognize more that the voice and that lived experience of CHWs, should they choose to share them, can be powerful. It can be transformative, and it should be respected. We recognize that it takes time to develop relationships. I know you guys are building rapport with your clients and your patients all of the time, and relationships are huge. Those are the sort of game changers. And I think for decision makers, it even takes time for them to develop relationships and respect and understanding. And that can make all of the difference. So what I'm going to talk through in these next few slides is how we have considered the fact that CHW's voices and their lived experience is transformative, and we've created a space to hear from those voices of CHWs and change the way that healthcare leaders think. So what we've built at Impact is really sort of a mentorship experience where we have a few goals. We want to build empathy. That's that feeling like, oh man, I get that experience. Because unfortunately, privileged folks don't often get it. They just have not had the experience to build empathy. They need to be taught it. And then we need to teach them how to be humble, right? Cultural humility is a big deal. And we need to sort of influence their decision making by nuancing some of this goodness in them, cultural humility, cultural competence, and all of that, and recognizing that their structures should be built to support, not hurt any, minority or community. We like authenticity. Look, I can't even say the word, but you know what I'm trying to say. We love authentic conversations. We love authentic dialogue. We love fostering personal growth and awareness among leaders, and privilege can shape life and health, right? So we need to make sure we're using that authentic dialogue in settings where people feel safe and comfortable to help transform. Man, that leader is going to think differently today because I made him think about the historical sort of biases and impact that he has come to consider throughout his life. And the biggest thing here is that we can work collaboratively. We can work together, a group project, on something that advances social justice and anti-racism. So we're picking apart systems at Impact, trying to encourage organizations to think deeply and structurally and strategically as a group, with CHWs leading this effort in an effort to change the game and the landscape of their system. Here's a bit of the nuts and bolts. So this mentorship at Impact lasts about a year, and I'm not gonna fake like it's something easy. It's a difficult year, but it's a transformative year when people are authentic, when they're really engaged, and they are really participating. We give our leaders homework. There is a curriculum where we're literally teaching them about racism and anti-racism, and really sort of systemic things like gerrymandering that have led to historic issues, right? We're teaching them about the depths of the thing, and we're doing so as groups and individuals. So you have some conversations on an individual level, then you've got some group conversations, and you got a lot of reading about the psychology, like the brain science behind racism and injustice. And I know you guys know that these concepts aren't easy to tackle. They're not easy to learn. They're not easy to speak through. And so we recognize that, we also have to support each other in this space, because authentic relationships and conversations can also be tough to have, and they could potentially be traumatic. So we make sure we provide sort of support for our CHWs who decide to be mentors in this space. And I must admit and share, if I haven't already, our CHWs are mentoring like the C-suite executives, the CEO, the COO, the top dogs in the healthcare system. So we're elevating their voice all the way to the top, to the corner office, room, and building, probably that's huge and probably bigger than my house, right? In some healthcare systems. And so we're going through, after that curriculum where people read and they learn, a practicum. And that's a group project where for about 8 months, we're tackling areas at organizations that they've identified as potentially problematic. Maybe they have some policies and procedures that they need to review, revamp, and rebuild, essentially, now that they've got some history under their belt, a bit of empathy and a bit more understanding, having been taught and led through tough stuff with the CHW. The topics that we cover during this year-long experience are pretty huge. Empathy, right? Tell me, how important is it that your leaders have empathy? Throw it in the chat, scale from 1 to 10. empathy to me is a 10. Like, I need to know that people I work with understand me and know what's going on and understand my community, right? I like to know, oh, somebody said 12, off the charts. I am feeling you, Veronica. Like, it's a big deal. Kevin said 100. Yes, so true. History is another thing. You can't really know where you're going unless you know where you've been, right? History of racism and injustice and sort of how ethnic groups have been, unfortunately experienced terrible things at the hands of other people. Like, we can't say that that stuff never happened. We have to acknowledge it and acknowledge that impact on our psychology, which is the next thing. Like, that's how your brain works. That's the brain science. And we operate and we do things based off of what we think and how we learn and what we do. So that's another important thing here that I'd like to share that we tackle. And then another thing that's key is policy. Everything we do stems from some rule in this world. So it's important to consider and think through all of the policy implications, that impact us. I have a question. I really want to pause here and just get you guys to tell me which of those four, empathy, history, psychology, or policy, do you think would be something you'd be most interested in helping people at your organization understand as a CHW who's an executive mentor? Malcolm is feeling me. Yes, he talking about all of them. I agree, Mr. Clay. Empathy, says Joshua Collier. Oh, we've got some history buffs in the room. Okay. Another one for empathy. They all go hand in hand. And for exactly, you really can't do one without all of them. So I think that it's very good to consider. If you're thinking here, man, how do I take this in my organization? Consider this and more that I'm sure you might think are good, important things to think about. All right. Let's keep going. I appreciate that. Like, policy change is sometimes the biggest and most difficult thing, right? Where it just takes some time. That's why we give leaders 8 months in this process to change some policies at their organization in support and with a community health worker. The goal of that practicum that I just referenced is to identify the areas where change needs to happen. Nothing's perfect. No one is perfect. Systems are definitely not. And I think I often think about this in my own work and life is like, I'm just for continuous quality improvement. So sometimes I just need to realize that, you know what, girl, you got some growing to do. And here's an area where you need to do so. This is what we ask those leaders, those executives to do. Like, look at the swath of your policies and how you think about your strategies. And then maybe there's something in there where change needs to happen, even if it's a little thing, like making sure when you're talking about healthcare teams and changes related to CHWs, make sure a CHW is in the room, make it a requirement, right? Make sure you don't do strategic planning without community health workers. Like, those are the types of things that we are encouraging leaders to think through. And it can be done as a group project or on an individual level with CHWs. All right, I'm going to go on to this next slide. Now, I'm going through all of the good, fun, fuzzy stuff, but nothing's ever as smooth as you want it to be, right? I'm somebody that loves to cook, and I just have to always be on my P's and Q's, right? I just always need to think about, adding a little salt here or pepper there, like, and then if I add too much pepper, here's what may happen. It might be a little bit too spicy. I'm not really sure that story matches this conversation, but it came out my mouth, so we're just going to go with it. There are some successes and challenges in this space when we're trying to do something great. There's often some challenges that come along with it. The goal of this experience is huge. It is a lofty goal to get people to think differently, to help rewire their brains, and then come out of this with some sort of strategy or operational change. And that stuff is difficult to influence. These concepts that we're talking through are deeply rooted in one's background and personal history. And it takes an authentic CHW and authentic leaders to attempt to even go there, to really think through the who, the whys, and the whats of what they do. And oftentimes, relationships take a long time. How much time do you guys spend with your patients? I'm curious, how quickly are you guys able to build authentic relationships as CHWs? Go ahead and throw it in the chat. Is it a week, two, a month, 6 months? How much time are you spending building relationships with your patients? How much time? At Impact, we typically spend 2 to 4 weeks or more. We do deal with them every day, so this is good. It really can depend, but either way it goes, relationships takes change, right? Sometimes you gotta just, put one foot in front of the other, right? Like you build on relationships with every interaction. Don't judge my singing because I definitely can't. But anyway, I want you guys to think about that sometimes 12 months isn't long enough to go ahead and develop the conversations and the depths of the relationship. So we think about that, like maybe 12 months is not enough, but 12 months is a big commitment for leaders of healthcare organizations. These conversations that we're leading can be transformative. FCHWs lead people through tough things, but they can also be difficult. Like the tough conversations can be hard to have for CHWs, and it can be, traumatizing. It can be triggering, right? It can be sort of difficult to go through, injustices that you've experienced as a CHW and to try and teach someone who doesn't get it. Like that can be traumatic. And so we recognize that there has to be a space for CHWs to feel heard and to share, man, I didn't have a good day. I need tomorrow off. I need a mental health day, because that took all of my mental health to guide that leader through that conversation. And we've experienced that. Some of our mentees have been like, yo, that was some really tough stuff. And I need to sit on a couch with my therapist, decompress, get myself together so that I can pour back in to others tomorrow. And we recognize how important that is. And we know that we got to give people the space and the grace to come and be who they are. And my child has joined this room, so forgive me, my fur baby. One of them is in my lap at this space. So we want you to, sort of encourage leaders to know that, man, if I'm going to do this, I need you to respect that I need a day. I need a mental health day. I need to be okay, because I can't help pour in if I'm an empty cup. I say that all the time. Take care of you and you can take care of more. All right. So the change that we're asking in this space, that we're asking these leaders to think through, are systemic changes, and they are often difficult to actually see. Like you can't really see somebody's brain and their psychology, switching, right? It's sometimes invisible to see that someone's learned something. So we need to be mindful of that fact. Like we as CHWs like to see stuff get done. We like to see change happen. We like to see minds and lives change and people overcoming things. And sometimes this type of change isn't easily seen. It is invisible. It is deep. And we have to be mindful of level setting, what success looks like, and changing what we think of when we see that we've affected some change, okay? There are shifts in psychological mindsets that are often difficult to see. Like I said, like you won't know that you've really changed my mind unless I express it or you see it in another interaction. And sometimes that can be challenging for CHWs to get comfortable in knowing that maybe the change that I am influencing in this person won't be seen today or tomorrow, but maybe you're influencing them so much that the next interaction with the next CHW that they have will be a game changer. And so all of this stuff takes a toll On CHWs. Exactly. You're planting seeds. I say this all the time, Jennifer, in children's church. I tell the kids, like, we're just planting seeds, and then life will water these things and it will grow. And one day you'll be able to lean on it as a tree. It's the same thing here for CHWs as, executive mentors. And so we need to make sure we respect that, right? Like, as you're planting seeds, gardeners and farmers get tired. Like, they out here in the sun, they don't get paid well. And that's not to mention, like, we're asking people to do this on top of their day job. So we have to be respectful of CHWs. Like, we're asking you to level up as executive mentors. We also need to pay, a stipend and make it an incentive for folks to also participate in this thing. And so I think of this often, like, self-care and support are truly key components of this. You can't do this well without making sure you stress the importance of self-care. You stress and you share up front that this can be triggering, and you make sure folks have a safe space where they can go to decompress all of this stuff. All right, I'm going to keep going. I think I only have a couple more slides here. I'm trying to get to the next slide, but it's not working. There we go. So essentially, I'm going to stop talking and see if there are any questions that you guys have. But CHWs are the next generation of the healthcare workforce. We can help communities power the new health, and we can also make sure we are respecting your voices and uplifting them. So we are making sure that CHW is heard, is respected, and I just want you guys to know that you got the power. The word power is on this slide for a reason. You guys have the power to lead, to change, and transform mindsets. Use that voice that you have, and I'm telling you, is a game changer. I'm going to stop sharing my screen and see if we have any questions. All right, any questions? We have one. Will the slides be available after the conference? I'm not sure that they're posting our slides, Mr. Clay, but I do think they're recording this session and will likely post it on their website and maybe even YouTube. And, once they're able to merge all of this great content. Okay, let me see. Got another question. Miss Lorena Fernandez. So, Mr. Clay, make sure I answered your question appropriately. Okay. In a large organization, from Lorena Fernandez, do you see a nomination system or application system for mentees? Oh, yes. So in a large organization, when we are partnering with new organizations, what we try to do is have them identify which sort of leaders want to participate in the process. So it's not necessarily an application process, but like an opt-in, like, yes, I am in. And that's how it's worked for organizations that are large and small who want to be mentored by CHWs. We do have sort of an application process for CHWs who want to participate in this, just so we make sure they know what our expectations are and how tough this can be, to make sure we're not putting them in a place or a space where they're uncomfortable as well. Hopefully, Ms. Fernandez, I've answered your question. Yes, thank you. Perfect. Okay, moving on to Katina Cummings. Sorry you joined late. That's okay. You just didn't miss anything but me talking. Is the mentoring program for individual COOs or group, or both? It is actually a combination of all of that. So each CHW is paired with a mentee who could be a COO or a CEO. And then you have people who are, participating in the mentorship experience at the same time. So you could have, up to 3 CHWs and then up to 3 executive leaders or so that all, will participate in individual conversations. And then those group conversations that I shared, they will do so together. And do you do an assessment before you meet with them? No, but that's a good idea. It would be good to do sort of a baseline assessment about, hey, what do you think about X, Y, and Z? And then at the end, we could see how they have transformed as a result of the mentorship program. Oh, I really love that idea. Thanks, Katina. All right. Is there training for CHW mentors before? Oh, absolutely. Absolutely. Okay, and I do see you, Regina. I got the I got the questions in the Q&A coming up next. Is there training for CHW mentors before, or another person who guides the conversations? We train our CHWs how to mediate tough stuff. So they go through sort of this preliminary like mentor prep experience where we have pretty awesome trainers. I'm very biased of them. They get the CHWs where they need to go. So you learn not only how to lead, how to sort of, deal with conflict, how to decompress, how to know when it's enough for you. So they definitely do go through adequate training because we don't guide them throughout. We just support them after, if that makes any sense. Okay, Regina, now up to you. When is the application period for this experience? It really does depend. At Impact, we don't really have like an application period. This is something that we offer every new program and or organization that we are launching the impact model at. So the decision to get people as mentees and mentors to the table sort of happens in the beginning of our visioning and strategy sessions. Regina, I hope that makes sense. I hope that makes sense. There could be an application period for it if other organizations choose to do it that way. Then Regina has another question. Do you have CHWs in Texas that have participated? I am a CHW in San Antonio. Oh, Tejas. I think we only have like a few community health workers in Texas. That's not a place where we've got a huge footprint. And so I don't believe that we don't have any CHWs that have gone through this type of mentorship program in Texas to date, but I am hopeful that we will be able to do so as we continue to grow. Awesome. Any other questions? Is your training program available to individual CHWs not affiliated with an organization? Okay, now this is a tough question, anonymous attendee. Are you speaking about this training program that I'm talking about today, this mentorship experience? If that is true, then the answer is no, it's not available to individual community health workers. We do have, I guess, impacts other training offerings. Okay, exactly. So I just answered your question. Not available for individuals, though that's something I can think about. How can we provide this sort of experience for community health workers at large? I have to think that through because we're going to want to make sure we're doing this in a way that, people can really get face time. That's the key thing about this mentorship experience. It's like in person, it's intense, and it really works well when folks are at the same organization and informing policy together in their organization. Awesome. Hopefully that answered your question, anonymous attendee. All right. Regina says, I work in the rural counties and racism and inequity are experienced daily. Honey, don't I know it? I don't live in a rural area, but I've worked in some and I understand that. And even in Metro Detroit, I'm from Detroit and I live like halfway between Detroit and Flint. And literally, like every day, it's just inequity all over the place. I wish I could wave a magic wand and say, hey, let's change. But again, this stuff is the long game. So hopefully you guys are encouraged and feel the need to sort of think through what this might look like at your organization. So I'm just going to click these things that I've answered already. All right. And then Beatrice, she says, I think this is a great opportunity, not only in the medical field affecting CHW work? Oh, yes, but for the community as a whole, for people learning and growing. I love that. I completely agree. I think our experience and truly has to date and impact been primarily with healthcare organizations, though we're about to start launching our program into community-based settings. So I'm looking forward to the real transformation in community-based settings as well. And for some reason, I feel like that one might be easier to tackle because community-based organizations typically get it to start, right? And since they're working in such settings, they typically learn and act a little differently. I think there's still some opportunity there, but I'm looking forward to sort of taking this model and maybe coming back to you guys in a year or two about how we've done this in community-based settings. Okay, there's one thing I think I stopped sharing my slides before I shared my slide with my contact information. So why don't I go ahead and do that here? Like I said, my name is Janée. I reside in Michigan. I work as head of community mobilization here at Impact Care, and I am here for you. I am the biggest CHW advocate. I think I am, but probably not compared to all of the wonderful people in this room, at the Natural Unity Conference. But nothing makes me happier than waking up every day and doing things for community health workers and this workforce. I was once the executive director of the Michigan Community Health Worker Alliance. So, CHWs are my joy bubble. Like, I really do love you guys. And so if you want to reach out, let me know. Can you see my email? It looks a little dark up there, so maybe I'll just throw it in the chat here. But you can feel free to reach out. I'm the type of person that likes to respond. So sorry, Jennifer, you can't see it, but I have gone ahead and thrown it in the chat there. It's my first initial, last name, Tyus, at Impact Care. Don't forget the HQ.com. And hopefully you guys can't hear my other fur baby acting a little crazy because it is about dinner time for the two of them. Any other questions? It was a pleasure speaking to you guys today. It was really a pleasure. Thank you for joining this session. I hope you've learned something related to how important your voices are and how important it is for people to hear from your experiences. We can all learn from you. So I encourage you guys to lean in, to share your voice. Regina, I'm throwing my email back in the chat. If you scroll up, it's there, but here it is again for you to go ahead and grab. And I think somehow I spoke too quickly. I was supposed to have Ashlee with me. She couldn't speak today. She's traveling. So unfortunately, it just got me. Hopefully that was enough, but good to see you, Katina. I'll tell Ashlee you said hello. All right, here's my email address coming in again. Okay. Is it okay if we end a little early? It seems like you guys are about to get another break. I think our supporter host is gone, so I think I'm actually gonna oh, thank you, Joshua, for you know what? That's the problem. I was posting my email address, oh man, to the host and panelists, which is just myself. Now can you see my email? There we go. Oh gosh. Okay. Thank you guys so much. All right. So for the sake of me finally putting my email where it belonged, I am going to go ahead and end this conversation. Again, it was a pleasure to see you. And I think you guys have a little bit of time. I think the next session starts in about a half hour. Feel free to reach out to me if you have any questions, comments, or concerns.